Good morning, Dr. McHenry coming to you with another COVID-19 update. Today is Friday, March 27th. As of today, there are 399 cases in Maricopa County. Of that, only 5 deaths. We are running less than 1% death rate from COVID-19, and the majority of those have been in the elderly and those with comorbidities in the younger age groups. And by comorbidities, meaning disease states that make the COVID infection worse: diabetes, heart disease, asthma, lung disease, etc. Additionally, currently only a 20% hospitalization rate. So 80% of people with the disease are not even in need of hospitalization. Hopefully we'll be seeing a corner turn on the East Coast cases and the requirements of ventilators, etc. on the East Coast to then ship supplies further west if we are to see that surge that has been predicted in April and May. I personally believe Arizona will continue to be one of the states with lower counts compared to California, Washington, and New York. However, that is my personal professional opinion. We are still in the orange range for cases. We are not in the darker red on the U.S. map as California is, and hopefully we will remain that way. Another update: ibuprofen has recently been disparaged in social media and in the news. This was due to an article in the journal Lancet, a medical journal, which said that ibuprofen may upregulate the receptors that the COVID virus attaches to. This was never proven. This was theoretical and still has not played out in many cases. There are doctors still using ibuprofen to treat the pain and fever of COVID-19. However, my personal opinion of anti-inflammatory medications are, if you don't need them, absolutely don't use them. They do affect gut immunity and gut health, and thereby can weaken your immunity if you're using them on a regular basis. As for testing, we are still doing swab testing here in the office. We actually do it outside in your car. If you are a high-risk patient with symptoms and preferably a fever as well. If you're unsure about getting tested, always reach out to me and we can discuss it on the phone. As of next week, we shall be receiving a shipment of blood tests to do antibody testing. So those who have symptomology or those who may have felt as though they possibly had this in the past, from January forward, we will be doing antibody tests as part of a study with Vibrant America to determine whether a home finger prick test is as effective or as accurate as a blood draw. So we will be starting that next week, and I'll put a video update next week about that. Again, feel confident that Arizona is in low numbers. I still stress to those of you above 60 years old and those of you with comorbid conditions of heart disease, lung disease, diabetes, asthma, to maintain your social distancing. Practice all of the good hand washing that we've discussed and keep yourself safe and free of disease. And I look forward to talking to you again. Thanks and have a good weekend.